All right, nurses. Today I want to come on here and talk about why it's so hard to have a consistent self care routine and consistently take care of yourself and feel better. I know for a lot of nurses, including myself in the past, I would like get into a good routine, whether it would be with working out or nutrition or those kinds of things. Like I would start like getting into a really good system with myself, and then after a few weeks it would like fall off the map, and I'd have a couple bad shifts at work, and like I would not be able to consistently continue to show up and take care of myself. So I want to kind of talk about like why this happens and why it's important to take care of ourselves, but like especially as nurses, there's different things that we need to understand and be aware of so that we can take care of ourselves better, so that we can heal from burnout, so that we can truly thrive and live our best lives. Okay. So, my name is Jana Holterman. I am a nurse burnout coach. I currently still work in a CVICU setting, as well as build my coaching practice. So, um, when it comes to feeling better as a nurse, it really, to start with, we have to understand how our brains work. And our brains really are designed to keep us safe and to keep us comfortable. And a lot of the times, our brains try to use the least amount of energy possible. But that does not always lead to us doing things that help us feel better. A lot of the times that says, okay, we're depleted, we're burnt out, we're emotionally, physically, mentally exhausted. So what do we want to do? We want to lie on the couch, we want to watch Netflix, and we want to eat ice cream or drink a bottle of wine to try to like numb out and really disconnect from the shift that we just had. But the problem is that all those activities just lead us to feeling worse for longer. In the moment, those activities feel great. Like, just binge watching Netflix, lying on the couch. And sometimes we need that time. We need that time to rest and recover. But when that time, like, consumes, like an entire recovery day. So if you have to work your 3 shifts at the hospital and then you need an entire day or 2 days to recover from your shifts, and what you're doing is like lying around watching Netflix, just trying to like be able to function again, that is a state of burnout. But also, what you can do to help make yourself feel better, we're going to talk about a little bit more. So, those things are helping you feel better in that moment, but over the long run, they are contributing to your burnout and not allowing you to heal and feel better. So, as I said, your brain is always going to choose comfort. It's always going to want to do the thing that revolves around the least amount of energy. So, the least amount of energy is lying on your couch watching Netflix. But that does not help you feel better in the long run. That does not help you feel better overall, continuing to move forward. So, we have to actually overcome something called like discomfort to get us out of that zone. So I want to use my little whiteboard here, and I'm just going to shift this over a bit so you can see it. And basically what we do, I like to like this is basically going to draw a bullseye. So you have a center zone, and this is your comfort zone. This is the place where your brain wants to be all the time. This is probably you coming home, being depleted from your shift, and spending an entire day trying to recover to get back ready to function as a human being. This is the comfort zone. Your brain is always going to want to bring you here. But when you start to want to do a new self-care routine, when you start to show up and say, okay, I want to go to the gym, or I want to work on my mindset, or I want to get my nutrition in a better spot, your brain is going to come up with all kinds of really good, valid excuses to try to keep you in this comfort zone. I mean, whether it be like, oh, I have to clean the house, or I have to go to the grocery store, I have to run these errands, like, oh, I can't go to the gym right now, I have to do XYZ. This is my brain is always like, oh, I gotta clean the house, I gotta go do these things, I gotta take Acorn for a walk and like take care of him, and all of those things are valid reasons, but they do not need to prevent you from doing the things that make you better and feel better. And I promise you, when you start doing the things that make you feel better, you will create more time to do all those other amazing things that you have to do anyway. Or alternatively is hiring somebody to help you with those things. So this is center thing is your comfort zone. I know if I write, you're not going to be able to see it. It's going to be too small. So this center circle is your comfort zone. Then what we have is an outer circle. This is your zone of discomfort. Okay, so this is the space that you step into when you're doing something new, when you decide you want to commit to yourself, when you want to invest in yourself, when you want to hire a life coach, when you want to go to the gym, when you want to start a nutrition program, when you want to even change your nursing job, when you're trying to apply for a promotion or do any of that stuff. Those are all activities that step you into your zone of discomfort. What your brain is trained to do is to keep you safe and protected. And I think like one caveat to always mention is our brains really are designed for like, caveman, hunter-gatherer times when our threats would be like, lions, tigers, and bears, oh my, rather than like our current society where most of the time we have very few threats. So our brain is seeing new activities, putting us into new situations as potential threats because it doesn't know how to keep us safe. And I think it's really important for you as a nurse to understand that. Like every time you try to do something different in your career, in your personal life, it's stepping you into that zone of discomfort, and your brain is going to come up with those really good reasons why you should come back into your comfort zone. And as I said, like my brain is always like, you got to clean the house, you got to run these errands, you got to take the dog for a walk, you got to do all these other things before you do those things. And what happens is you stop yourself from doing those things. So this is why you fall off the wagon. When you start a new routine, we have motivation, and then once that motivation gets dwindled, then if you fall off the wagon, you go back into the comfort zone. So the center is the comfort zone, then we have the zone of discomfort. This is honestly where the growth happens. If you want to be healing from your burnout, if you want to feel better physically, mentally, emotionally, and start actually enjoying your nursing career, if you want to have the energy and the capacity to show up and be fully present and take care of your patients at work, and then come home and have the energy to build relationships with your loved ones, to be fully present for those around you and have hobbies and do those things, you need to be getting into that zone of discomfort in order to create habits and things that help you feel better. And the amazing thing is that as you overcome that urge, as you continue to do those things that make yourself feel better in the zone of discomfort or move you forward, that zone of discomfort, this second area, becomes your comfort zone. You move in. So your comfort zone then expands and it becomes bigger. You have more things that become in your comfort zone, and that those health routines, the things, whether it be that promotion or the things that you're working for in your nursing career or that new role or your healthcare routines, the things that make you feel better as a nurse and allow you to show up and really make an impact become your comfort zone. And then there's bigger things, and you can continue to grow and expand that zone of discomfort. The other thing to really note is there are things that you're not necessarily ready for where you are right now. So if you're in this state of burnout, when you're completely drained and exhausted, you have that mental drain, the physical drain, the emotional drain, you feel completely depleted, there is a zone outside of that zone of discomfort. So we have the comfort zone again, we have the zone of discomfort. This is really kind of the outside rim is the zone of triggering, basically. Those things that you're not ready for. So you can't go from where you are now to be okay, I'm gonna become, go from being a bedside nurse who's exhausted, drained mentally, physically, emotionally, to being I'm gonna be the president of this nursing organization and completely change the face of healthcare. You can't do that in one step. Your brain is probably just going to shut down. It's going to freak out and be whoa, no, we can't do that. And you're going to come back to your comfort zone. But what you can do is you can start taking care of yourself. You can start like signing up for different clubs and resources and build those strengths to expand your comfort zone. And then what happens as your comfort zone expands, like as we get into that bigger and bigger comfort zone, all the things that were in your zone of discomfort become your comfort zone. Then the things that used to trigger you that were like too big of a step for your brain become that zone of discomfort. And that's really like how we grow. And this is really a lot of the work that I do with my clients is like we start with them being in their comfort zone as a nurse, and we start to heal the burnout. And I think it really does, like with coaching, it incorporates the mental side, the physical side, and the emotional side. We have to really start to treat and heal burnout from all aspects. If you are really working on one, you will see some improvement, but you're not going to be able to like fully eliminate burnout from your life and move forward to be able to create that nursing career that you absolutely love, so you have that energy and capacity to love your life outside of nursing as well as inside of nursing. So it takes that step by step process. It's working and focusing on one thing at a time and moving your comfort zone out bigger and bigger and having that capacity to show up, to heal, to do the things that make you feel better. And it really is like a step by step process. So I really hope this kind of like helps you understand maybe in the past, like when you did that healthcare routine and it kind of slid after a while. It's really it's it's really about like helping you figure out what works for you and doing this step by step process, but understanding how your brain works so that you can use it to your benefit, because I always want you to like be aware, but then also like it's so much easier when we actually understand ourselves. um Somebody said like I always go to the gym but I don't lose weight. And I think this is something that a lot of nurses really do struggle with, is weight loss, and it's something that like I don't necessarily focus on in my coaching program, but I have had a lot of clients who do lose weight because you're doing the things that make you feel better. And a lot of weight loss is about expectations. And in this zone of discomfort, it's showing up consistently and creating routines that work better for you. So if you're finding yourself like, working really hard and then like you fall off the wagon, and then you eat really well for a while and then you like binge eat and try to like recover. And especially as nurses, if we're having these really high expectations and say like, okay, there's this person who works 9 to 5, follow her on Instagram. She has all these really great workout routines and I try to follow them, but you're working like 3 12-hour shifts and expecting yourself to be able to physically do the same things as that person who's working 9 to 5. The expectation is not necessarily realistic for you as a nurse, as a shift worker. So what it takes is saying, okay, what can we do that you enjoy doing so that you're going to do it consistently, because that's a huge thing too, but also like how can we make it fit your life, your schedule, so that it's actually healthy for your body. So if you're working 12 13 hour shifts and then you're completely physically, mentally drained and exhausted, and then you're trying to push yourself to work out and do all these things after that 13-hour shift, majority of the time this is actually going to harm your body and it's going to put you back. So it's really about creating healthcare routines and having expectations of your body for where you're at and what you enjoy doing. So I always partner with my clients to help them create health routines that work for their life, work for their particular schedule, and are things that they enjoy. And then creating goals and things that are a little bit of a stretch but also realistic for their lifestyle. And I think that is something that creates results, is making it custom. You can't necessarily like what works for somebody else is not going to work for you. And especially if they're not a shift worker, if they aren't understanding the pressures that there are inherently in nursing and the demand on our body, it's going to be difficult to create those systems and routines. So I hope that answers your question. Feel free to ask any more questions below. I hope you all have an amazing day, and I will talk to you all again soon.